Why cervical RF ablation beats surgery for whiplash neck pain? Cost-effective relief. What if I told you that surgery isn't the only answer for post-car accident neck pain? That you can avoid major spine surgery and still get long-lasting relief at a fraction of the cost? Cervical radiofrequency ablation, RF, offers just that. Surgical fusion can exceed 6 figures. RF, just a few thousand, yet the pain relief, often just as effective. The hidden costs of neck surgery. Cervical fusion or disc replacement is frequently pushed for whiplash-related neck pain, especially in legal and personal injury circles. But the economic cost is staggering, over $100,000 in many settlements. And the outcomes? Limited functional improvement, higher risk, and a recovery that drags for months. The mechanics of RF ablation post-accident. Chronic neck pain often comes from the cervical facet joints, the small joints at each vertebral level. Studies show they're responsible for up to 60% of chronic neck pain cases after a collision. RF ablation targets the medial branch nerves that supply these joints. 2 rounds of diagnostic nerve blocks confirm the pain generator. Then a thermal probe interrupts the nerve's pain transmission. Simple, precise, effective. What does the data say? Between 50% and 66% of patients experience at least 50% pain relief after RF. Relief lasts from 6 to 14 months, sometimes up to 24. In one study, the median pain-free interval was nearly 20 months. At just 2 months, mean pain scores dropped by over 3 points on the numeric scale. That's powerful. Let's talk cost. A quality of life improvement study documented a cost of about $5,000 for medial branch blocks, or slightly more for the RF ablation. But RF patients needed fewer treatments annually, less procedure volume, same benefit. And compared to surgery, RF is pennies on the dollar. An RF procedure might cost $3,000 to $5,000 per cervical level versus $100,000 plus for the surgical fusion. Why RF is the smarter first move? RF is minimally invasive, outpatient, done without general anesthesia. Recovery, same day. Complications, rare and mild. And if it fails, surgery is still an option. Doing surgery first if RF could have worked, that's bad economics and worse medicine. Insurers often argue that chronic neck pain is degenerative, not accident-related. But with diagnostic precision medial branch blocks with more than 80% relief, you can prove causation. From a legal context, RF has settled claims for far less than surgery, but with faster return to work and lower risk. And if the patient needs the surgery later, they can still get it. If you're still in pain months after a car crash and staring down a surgical referral, ask for diagnostic medial branch blocks. If you get relief, RF ablation could be your exit ramp from chronic pain without the cost and risk of surgery. Cervical RF ablation, less invasive, more precise, economically smarter. Before you fuse, ablate.